Good morning. So let's start talking about AI in healthcare itself. One of the one of the biggest impacts that everyone is expecting AI to have is on the healthcare industry, which is really, really fascinating because historically the healthcare industry has been one of the most technologically, whatever the opposite of advanced is, in across all different sectors and industries. And so it's really interesting to see all the promise and all the excitement around AI when it comes to healthcare. Now, there's a lot of, we'll talk about some of the generalized today. We're going to do pretty general. We'll continue to give more deep dive content into specific companies and tools and things like that. But there's, let's go through some general advantages and disadvantages. General advantages, there's a lot of promise because what AI is going to be able to do is understand. It's able to have a brain that encompasses everything, like all the knowledge, right? And it's also able to continuously learn. So once again, like we talked about in yesterday's video, you don't have to code AI from A to Z. You don't have to build AI in a way that you are actually creating all the if this then that kind of trees and branches. AI will actually continue to grow upon itself and continue to learn and continue to grow far beyond the initial creation of the AI. That is the nature of it. It's you're creating something that can grow. And so it can continue to come up with new understandings, new advancements that even us humans may not be able to see. It also is capable, it's a computer, it's a supercomputer. So it's also capable of seeing tiny little data points and recognizing patterns from massive amounts of data. And so these things, when you talk about those applications in healthcare, there's a lot of big promise, and there's different categories of it. So if we see from this Forbes article, they kind of break it down to AI-assisted robotic surgery. Imagine being able to be so precise that possibly there would be a lot less need for maybe certain invasive surgeries or certain just the way that surgeries are done. It can be a lot more pinpointed and exact in what is needed rather than having to maybe other cuts that wouldn't be necessary with AI. Clinical judgment or diagnosis. So this is obviously a big fear because if AI, and we'll get to the disadvantages in a second, but AI, this can also go equally wrong. If AI isn't trained properly, and it could be making, wrong diagnoses and wrong predictions and things like that, then that can obviously be tremendously detrimental. However, there's definitely a side to it that it can look at, like we said, these massive data sets and be able to kind of see things even in a preventive sense. It can notice things that us humans just simply wouldn't even necessarily be able to see. This for sure, workflow and administrative tasks. Healthcare is one of the heaviest, one of the industries that is so bogged down by administrative tasks. If you look at burnout from doctors and from nurses and from clinical staff across the spectrum, one of the biggest things is all the administrative tasks, all the documentation, all the paperwork, and it's absolutely necessary. But right now, that all falls on the human. And 99% of these people, they went to medical school or they went to nursing school to learn how to care for patients. They didn't go to school to learn how to code correctly and to learn how to, create the perfect documentation, to spend hours on the phone trying to get a pre-authorization. And all this is not why doctors and nurses and clinical staff went to school. And so many of them they're getting out of school, they're getting into the system and finding that for every 10 minutes they're spending with the patient, they're spending 30 minutes on documentation, and it's burning them out. So workflows that can be automated and administrative tasks that can be automated is going to be huge in healthcare. And although that's not specific to healthcare, workflows can be automated across anything with AI, but it's going to have a special impact on healthcare because it's so integral to today's healthcare landscape. Meaning documentation and administrative burden is so integral to providing patient care that alleviating that is going to make a tremendous difference. Image analysis, this is another really interesting one. So talk about AI being able to see because it's a computer, so it doesn't have a physical eye, so it's able to see the tiniest little things when it comes to imaging. And so we'll jump into an example of one of these companies in a second. And so we see that there's a lot here, right? There's a lot of promise. There's a lot of tools are going to come out that are small tools, but there's obviously some companies that are working on big picture things like imaging and diagnosing and using AI. And like when you talk about robotic surgery, that's obviously a huge shift. And and something that's tremendous. So that's definitely some of the advantages and the promise of AI in healthcare. Some of the disadvantages is, once again, AI is not perfect, and in healthcare you can have nothing short of perfection. You can't have AI giving almost correct diagnoses, because it also wouldn't be almost correct. It would be like either correct or just incorrect, which would be obviously horrible and detrimental to the patient's health. And so there's that. And then obviously there's data and privacy concerns. You're talking about computers essentially processing and understanding um, just millions and millions of patients' healthcare data. So that's obviously concerns when it comes to, well, what if there's a breach? And what if someone gets a hold of that data and being able to manipulate that data? And so there's obviously, there's HIPAA concerns, or there's general privacy and kind of data concerns. And so also, even though AI can really process and analyze data at like these massive speeds, but it also is a computer. And a big part of healthcare, and this is what we don't want people to forget, a big part of healthcare is not the computer, it's not the data, it's the human touch, it's the human understanding. When we start talking about social determinants of health and population health, we're talking about really digging in with that patient. It's not just looking at data and being a robot, a really, really good robot, but so much of healthcare is the actual human connection and the empathy and the understanding of context and understanding of where a person grew up and what their social determinants are, and what's available to them resource wise and what's not. And a lot of that is really is more part of human communication than having a really good robot doing that. Now, possibly down the line, AI can be optimized for things like social determinants of health and having those conversations with the patients. But the way things stand right now, AI is still a tool. And so it cannot take over the healthcare relationship. We cannot let it take over and make healthcare less personal when we're trying to make healthcare more personal. And so I think that's a really important point. We want people to focus on utilizing healthcare to help make the doctor and the clinician and the care manager more efficient and more effective, and empower them to be, better, like to better communicate with the patient, not give that over to AI. We want AI to take on the things that that are really good, like that it should, and not get involved in disrupting that human connection. So that's obviously a downside. And then also, like we talked about in the video yesterday, just general AI. Like, are we training it to take over all the doctors in the world? Like, because of the nature of AI, which is so different than any other technology, where you're growing something that's going to grow upon itself and teach itself and continue to learn and learn and learn, like a child that grows into an adult, and the parents don't know what that child is up to anymore. And when they went off to school and learned, something, or read a certain book, parents don't know that, because the child is now its own creation. That's how AI is. And so obviously there's the general fears of, wait a second, the base of this technology is something that could literally turn into a super a species that is more advanced than the human species, and it could take us over. And if you're interested in that, you can look at yesterday's video. But that's where government regulation comes in. And so people are saying, and especially when it comes to healthcare, because like we talked about the data concerns and the privacy concerns, and so people are saying, let's make sure that the government is regulating this stuff. But I really question whether the government is even capable of understanding and keeping up with, well, forget about keeping up with AI and the fact that it's moving so quickly. And government by nature is a bunch of red tape that is not really able to keep up with that. But just in general, I really, really struggle. And I'm really curious to hear if anyone has an argument as to why yes. But I really struggle with accepting the idea that the government can actually deal with regulating AI in a competent, meaningful, and intelligent fashion. I mean, every time I see, maybe this is just me, but every time I see like a congressional hearing, or someone's up on the Hill testifying about something or another in technology, it always just looks like a joke to me. It looks like a bunch of people that are very disconnected from technology. They're still saying things like the Twitter and the Facebook and the Google, and they don't really have a keen understanding of generalized technology, let alone the cutting edge of AI, and even understanding or wrapping their head around what it is. And that's the thing, they're politicians, they spend their time doing politics. And if you're not spending your time really dealing with AI and using it on a day-to-day basis, you cannot even understand what it does. You can't understand what its capabilities are, and thus what the dangers are. And so the concern with government regulations, on the one hand, is absolutely necessary because AI can totally go in the wrong direction, take over human civilization. But on the flip side, the government isn't really that competent. And when it comes to, and especially when it comes to something like this. So I'd be, once again, very curious to hear if anyone has any positive thoughts there. But that's my concerns with kind of general government regulation. Now, for today, we're just give two quick examples. So this is a company, you'll see this is an article from Harvard. And so there's this company called Zebra Medical Vision. They've been around for quite a while, and they are using AI for imaging, like we talked about. And so they're for radiologists, and it's pretty interesting. So they're using, so we'll look at a couple of the lines here. But basically, here's, AI can process images and the associated data quickly, picking up on details that might not be visible to the human eye and or that a human might not think is clinically relevant. So once again, when if AI, see, because that's the difference. AI is not being programmed to say, like, search for this and find this. It's more outcome oriented. So find, like, your purpose is to go and look through this data and find any abnormalities or find specific things, and then you tell it, like, the objective, what you want, the end result, and then it'll go out and do that, and it'll learn, and it'll understand, and so it's so different. So when it comes to imaging, this can be really interesting. Here's an interesting part of this: their business model. So the company is generating revenue by providing cloud-based analysis of images through its AI One service to over 50 medical centers in the US, Australia, Europe, and India, which is really cool. So they're partnered with Cedars-Sinai, Intermountain Healthcare, University of Oxford. These are huge organizations. And so these guys are charging, it looks like $1 per study. And then they're giving providers their own interpretations of what the clinically significant findings are for the images. And then right now it's probably in training phase where doctors are probably doing their own and then looking at Zebra and seeing what's kind of going on. But these guys have actually been around, since, I mean, this article was written in 2021, but I think they've been around since 2018. And so they're definitely have a jump start on this. I think they're probably the most established company in the imaging space. And then you have Google. Google launched this DeepMind Health. And so this is just a general project, but these guys have done things like one example of what they've done is they're supposedly able to diagnose eye disease with the same accuracy as human doctors. And so that's obviously very cool. Can read up on this a little bit more because the Google Health looks like it's part of this DeepMind Health thing. If you look here, and this is kind of just looks like a generalized project platform for things AI. And so, but even this was also back in 2019. And so, there's a lot going on from Google, but you see that there's obviously this huge focus on healthcare, but not just for the small things, but for the big things like changing the way we diagnose patients and we look at data and being able to trust AI with all that. So, the purpose of today's video is just kind of general understanding of, once again, the difference between AI versus regular technology, where we can hopefully go with this as a country, some of the disadvantages and some of the advantages of implementing and continuing to look at implementing AI in healthcare. Hope you enjoyed this video. Follow for more. We'll be putting out a lot of this content, and we're going to shift towards, we're going to be talking about healthcare, the applications for AI in healthcare in general, and specific to value-based care, which I think, well, I'm obviously passionate about. We have the Healthcare Trailblazers podcast, which is the #1 podcast in the space. And I think the applications are huge. So lots of more thoughts to come. Thanks for watching.